I'm David Belson on the faculty at the USC School of Engineering, and I've been teaching a course, or courses really, here for several years on how to improve healthcare operations. It's been a joy to teach this class because every year there's more and more students interested in the subject, and there's a lot of interest in the subject, I think, industry-wide on how to reduce costs in healthcare, how to provide more access to patients, and kind of streamline how healthcare works at doctors' offices, hospitals, clinics, all that sort of thing. And I think it's important this time, as everyone knows, that healthcare costs are very high in this country, and it's necessary to start to do something about it. And so my class is about how we can have a real impact on the cost of providing healthcare and providing tools for people such as yourself who work in healthcare or are interested in healthcare, things you can use to improve the operations of whatever service you're involved in providing. In engineering, we know that a lot of industries, a lot of companies have developed ways to do a better job of providing services. Companies like Toyota and others have learned how to produce products at a reasonable cost while maintaining high quality. There's no reason why that can't happen in healthcare, and of course it does happen in a lot of healthcare institutions. So what this course is about is to teach you tools, ideas, things you can use in your work or in the work in healthcare that apply and can be implemented promptly. I've been working in the area of healthcare for a number of years. I've done projects in the last few years in about a dozen different hospitals, in the surgery department, and diagnostic imaging, emergency department, all areas of the hospital. And we always find we can make a significant impact, in some cases doubling the number of patients that are seen every day with little or no added cost, in some cases with less cost. And so by doing these projects, I've learned what particular tools are very useful or practical that can be applied. And I'm also drawing on experience. I previously worked in other industries and with other employers. I worked for IBM for several years. I worked for Ernst & Young and consulting. And it gave me exposure to a variety of industries. But I think the biggest payoff of these operations improvement tools apply in healthcare. And the kind of things we cover in this course are ideas like queuing. Why do people wait in line? Why do we have to wait? How can we predict what waiting is going to be? How we can improve the wait for doctors as well as patients? Inventory and material control, how we manage inventory, what's the arithmetic involved. There is some mathematics in this course, but it's fairly straightforward, fairly simple. We give you the necessary background in order to understand what's going on. So we also talk about things like how do you implement change, how do you organize people as part of the change, set up a focus group, make the focus group worthwhile, how do you get change implemented. So we talk about that. How do you analyze what's going on, flow charting, process mapping, that sort of idea. So we discuss that and give you some case studies and projects to work on. So these are the kind of things we talk about in the class, as well as how do you make use of data. Hospitals have a lot of data on what happens to patients, as well as the rest of the staff. How do you analyze that? How do you develop a report card, a dashboard? How do you make use of information that's available? So all these things lead to a better operation in a healthcare institution, and the payoff is large. Another thing I've found, and students have reported back, they're able to use these tools over and over again. It's not just a one-time thing where they take the idea, use it once, and that's it. It's the kind of thing you can use over and over again. So the payoff is fairly substantial, and I think employers appreciate the fact that an employee can use these ideas in many different situations and use it over and over again. And even I've had some students say it's been a career-changing thing to take a course such as this because it's been the focus of how they approach their job in the future. So these are the kinds of things we cover in the course. Depending on what area you work in healthcare, I think most of these ideas are applicable. And so you'll see that all in this course, and we try to make it fun as well.